once you understand the weakness of the neck idea, so then you realize, right, is that with the weakness of the neck and the understanding of this position of the hyoid bone, and that she's using the superficial muscles, the mastoid, so the SCM and the trapezius as the main ones. But here you see these are the two ones which are highlighted on this image. So these are the muscles which are going from the hyoid bone to directly to the skull. So one goes to the bone here, just to the styloid, just under the ear, and one goes to this big mastoid process. So what does it mean? That in this situation, the trachea, well, so the tracheal cartilage and the hyoid bone are used as additional stabilizers for the head. So what does it mean? That means that when she swallows, she has to take this into account. And you were asking the question why she's not opening the mouth wide enough, or why she's not having enough of the mimic, like freedom and the activity there. Well, and why she wants to swallow only in one specific way. It's quite simple, because she tries to optimize the swallowing, which happens here at this area, whilst at the same time using the trachea, the tracheal cartilage and the hyoid bone as the anchors to stabilize the head. So when she tries to add the lips and the tongue activity into this picture, it just becomes too difficult. So that's why she sort of discovered how to get those elements off the map and only focus on the controls at the throat. So that's why she prefers the spoon feeding, right? And there are quite a lot of children, okay, but that's sort of in the, especially in a more severe condition, that they literally like just keep their mouth super open in such a way that the food would go directly at the back of the throat. So not processing and so on, but just getting it at the back of the throat and then just kind of gulping it in. So there are two scenarios, right? So you see some children are really doing a lot of mulling at the frontal box of the mouth and then having difficulties in getting it through the second box. And some children are the ones which are optimizing their whole control via the second box. So first box, second box. Some children are first box oriented, some children are second box oriented. What do we want? We want to maximize their interaction and the recruitment of both. But the fact that she has some working process there is good. So you see, in that sense, the children with the second box, they wouldn't be the ones who are playing so much with food. So, but that's what you're talking about, like the lollipop and so on, that even with the lollipop, she just does a few licks and she's not very engaged. So, but this is where you just need to be patient so that if she doesn't want to get into, if she can get stressed about the food, so patient. If she's playing with her hand, that's fine. If you give her the lollipop or something else, and just give her some chances to explore this area. So the first kind of box